Welcome to the Friends of NPACE podcast, brought to you by Haleon. As a leading global consumer healthcare company, Haleon is dedicated to delivering better everyday health with humanity. Known for trusted brands like Advil, Excedrin, and Voltaren, Haleon leverages science, innovation, and human understanding. Haleon is proud to collaborate with NPACE to educate healthcare professionals about our pain portfolio and the latest healthcare information. For more information, visit www.haleonhealthpartners.com.
Hey everyone, welcome to the Friends of NPACE podcast. I am Terri Schmitt, the executive director at NPACE, but I am so excited. We're here in season 3 about today's podcast because we had this guest on last season in a great podcast called Snooze Blues about pain and sleep. And it was the most listened to podcast we have ever had because she's so fantastic and such a great clinician. Yeah, you're famous. You're NPACE famous. But the last time we talked, Heather, I wrote this down. That's how I emailed you back. I'm like, we have to talk about this topic. So today, clinicians, we're going to talk about acupuncture. And I'm so excited to do that. So, Dr. Heather Jackson, you are a pain clinician practicing in supportive oncology and palliative care at the clinic in Vanderbilt Ingram Cancer Center at Vanderbilt University Medical Center. You're also an associate professor of nursing at Vanderbilt University School of Nursing. Yeah, School of Nursing. As well as the Vanderbilt School of Medicine and founding board member of the Pain Medicine Academy of Advanced Practices Providers. By the way, this is going to come out after your national conference in Orlando, but we're exhibiting there. We're so excited.
Oh, good.
Yeah, we're going to be there, and we've been supporting that because it's going to be great. There's all kinds of really cool. You guys are doing some great stuff, especially for the students. Yeah.
Right. Yeah, we're excited.
I'm so excited. So maybe we'll see you there. But you're a nursing scientist. You do research, and you have advanced the use of acupuncture for the treatment of pain and opioid dependence, which I did a lit search and found out is like, there's some good science behind that.
There is.
But you do it across the lifespan. Did I miss anything?
No, yeah. And I've also done it in the neonatal population as well. So kind of a really small subset of science.
No pun intended.
Yeah.
Well, okay, I do want to talk about the neonates because I'm a past NICU nurse and transport nurse. And once a NICU nurse, always a NICU nurse, no matter what. Like, I can only imagine what those little tiny acupuncture needles are like.
Yeah, it's really cool. They've got lots of options for them.
Okay, cool. Well, thank you for being here. We got your beautiful introduction in. My first question is, what is acupuncture? What is it in the bronze?
Yeah, and that's a great starting question, Terri, because a lot of people don't really know what it encompasses. And acupuncture can sort of be a comprehensive treatment of multiple different therapies. But the overall definition of acupuncture, the idea is that we have meridians and rivers, sort of like our bloodstream, right? Like our blood pathways and our veins and our arteries that go through our body. And that's how our chi or our energy flows. So the thought with acupuncture is you have different acupoints that channel those different energy areas. And by stimulating those acupoints with a needle, you're getting the flow of chi going. So the idea in acupuncture is if I have a blockage of chi, a blockage of energy in a certain area, it's causing a certain symptom and I'm having some sort of ailment. So if I go and get that unblocked by stimulating that acupoint, then I have that flow of chi again and my symptoms resolve. So that's the idea.
I love it because I'm also a Reiki practitioner and I have had such success with people who come and see me for things like anxiety reduction and stress and sleep. And there's really something to that. And audience, before you start emailing us all of this stuff, I want to gently remind you that science used to not believe in germ theory. So we really need continued research in this area. So I'm excited to hear what you're doing. How does acupuncture work? How does it help reduce pain? How do we know that? What sort of patients?
Yeah, so I started with acupuncture. Actually, it's what prompted me to get my PhD. So I was working in an interventional
Wow.
pain clinic, and I was reading all about the evidence, Terry, to your point. And of course, they've been doing acupuncture a lot longer than we've been doing medicine. So it's existing treatment with low adverse event profile. So I was looking into it from a pain perspective, seeing there's all this literature that it is actually helpful. So it can treat all types of pain. And really, acupuncture can treat all types of conditions, but where I've sort of looked into it and got interested in it was for pain. And then as I
Okay.
looked into it more, I looked into it for opioid dependence, that they do have it used for the NADA protocol for addiction. And it has shown wonderful evidence to show compliance with treatment regimens and getting patients off of opioid regimens and then helping with the physical withdrawal that they're feeling as well.
And I find that wildly interesting. I know you're the pain expert, and so that's how you got into it. Did you get certified when you were?
Yes. Yes. So nurse practitioners can get different certifications. The one that I went, and of course, it's depending on the state that you practice in, how you can
Yes.
practice it. But I got two, and they're auricular acupuncture techniques. So they're limited to the ear.
Yeah.
And the reason I did that was it was more affordable for my patients as well. So I was finding a barrier for my patients that I couldn't get them into our acupuncture clinic that was more expensive. It was a different site, and I couldn't get people to try it. So I got that certification, limited technique in the ear. I did the NADA protocol, and then I did the battlefield acupuncture protocol. So battlefield acupuncture treats pain, any type pain, and then the NADA is focused on opioid dependence and addiction treatment. They actually
Okay.
even use it for like PTSD. Like they'll go on site and say somewhere where there's been a hurricane or an earthquake or a tsunami. And they can actually have practitioners come and do the NADA protocol on people and calm everything down, right, while they're waiting for aid and that sort of thing. So that's what I got trained in and started performing. And that's what's prompted my research and what I went to do my PhD because I wanted to give access to the care. And I was able to do my clinic assessment and then offer acupuncture as well. And if we got some benefits, I was able to get them in with full body acupuncture.
Oh my gosh, you did interventional research. Okay, let's talk about your dissertation. I
I
mean, we
know,
all want
right?
to carry that book around forever. So, what did you find, and what have you done subsequently in this area?
Yeah, so we did have a difference in our populations when so I used it to wean people off of opioids. So people would
Okay.
come to me and I randomized them into two different groups. I did one where I just did the standard treatment like we normally do, gradually weaning, using adjuncts, using non-opioid treatments in combination with, your PT and interventional options. And then I had another group that was my intervention group where I gave them free acupuncture. And we did see differences in the amount of opioids that we were able to reduce. And they had differences in physical symptoms that they reported. So it was pretty cool. And then I took it further using that NICU background. Like you said, once a NICU nurse, you're always a
Always.
NICU nurse. I remembered those babies that I would care for that were withdrawing. And in the midst of an opioid epidemic, unfortunately, there were plenty of patients to look at this for. So we did acupressure for the babies
Mm.
using the same technique that I utilized for the adults. And again, we had great compliance. I did a feasibility study. It was well tolerated. And the qualitative, it wasn't statistically significant to say there was a difference in symptoms, but the qualitative feedback for the caregivers, the parents, the nurses, the nurse practitioners, they all did feel like there was a difference in comfort improved with the babies that had the acupressure stickers.
I love that so much. There's so much to qualitative work, especially in neonates. And you hit on something earlier when you said, really, this is safe and effective treatment with really no side effects.
Right.
Like,
Yeah.
that's huge. The NIH even says that. They're
Right.
like, yeah, you should use acupuncture.
Yeah, it's very minimal. Obviously there's always risks for like mild bruising and bleeding anytime we're using needles, but we utilize really small needles. So really very, very minimal risk.
Nice. I like that. So are you doing any research now?
Not currently. When I came over to the Cancer Center, though, for my leadership role, we did start advancing it in our Cancer Center. So that was sort of the next phase. Is I came out of my practice in interventional pain and went into supportive and palliative oncology, and we expanded the acupuncture for our cancer population. And it has been really helpful for neuropathy and for overall just calming down the nervous system, especially when they're going through so many treatments. So that's been really fun to see.
Nice. I love that. So at what point in pain or even in chronic or acute
Yeah.
should any clinician, because this is primarily a primary care audience,
Mhm.
when should we consider acupuncture and how do we find some reliable sources, or should we just get trained ourselves?
Yeah,
Like,
I mean, really, you got all three, right?
okay.
So I look at acupuncture, and what I had to learn, because I had to learn a lot when I was going through all this, is acupuncture can be used for anything. So the way I sort of describe acupuncture is like a complementary therapy. It can be used in combination with anything we're doing. So if we are treating a patient for an upper respiratory infection and their cough is really bothering them and they're having myofascial complaints from that, they can take their anti-inflammatory, they can take their prescribed regimen and be on their antibiotic, and they can also get acupuncture to help with those symptoms. And I look at an acupuncturist like an internal medicine provider. They can treat any ailment, any symptoms could be potentially enhanced or improved with acupuncture. And then there are techniques that a nurse practitioner, physician assistant can pursue, depending on their state and regulations and their practice environment.
I love that you said that twice now.
Yeah.
Yes, it depends on what state
Yes.
you're in and what the rules are.
Yes.
No, I really like that. I have patients who have chronic pain. I currently practice in a family practice telehealth setting across several states. Most patients with a lack of resources,
Yeah.
right? Or in healthcare deserts, which is bad. But how do I find someone who in those areas would be someone to refer to or might be not be economically feasible for patients to get at for pain? I hate just constantly writing for medications. We don't write for any
Right.
controlled substances, but gabapentin's now controlled in 7, maybe other states soon, and fall risk, and at some point that seems to not be effective as
Right.
much as it was in the beginning.
Yeah. So that's why I love acupuncture, because you can essentially add it to anything, but resources are a big deal. What I say, because we have regional sites at our clinics as well, what I say for those areas is get to know the community. And usually, as you sort of research into the community, you're able to find a referral source potentially. I myself partake in acupuncture, so near where my clinic is, I know a referral source that I could use. And then, of course, within my institution, we have an integrative center, fortunately. But that's what I would
Nice.
recommend is sort of knowing the community, getting to know what partnerships there could be, because there could be a potential collaboration there. If we refer to you, can you sort of streamline our patients in? Would you be able to give us a fast track? Could there be some sort of discount if we are referring to you? Those agreements have been worked out, as far as my knowledge, that I've seen in other companies. And then acupressure is always something that people can do on their own. So I often
Okay.
do that for patients where they'll give me a certain symptom and I'll say, here's a relaxing point that you could press on. And it's known to relax the nervous system if you're having a lot of anxiety or if you're having an acute pain episode. This could help sort of bring things back down while you're waiting on your medication to kick in.
Nice. So teaching the patients how they can help
Yeah.
themselves also. I really do like that. Okay, so
Yeah.
what are some misconceptions people have about acupuncture that you come across, like when you introduce it to a patient?
Yeah, a lot of people will say, I'm scared of needles. And honestly, it always surprises me for like the cancer population. I'm like, oh, you've been through way worse going through cancer treatments than you have, the worrying about the needle for acupuncture. But the needles vary. So most of the needles, like the needles I use, are extremely small. They're smaller than a needle you would even thread with, that you would even sew with. So it's extremely mild. And so that's the first point that I start off with. You see on TV maybe these really long needles, but Well, we can also vary that. We can use really, really small needles and we can sort of progress. Even
Okay.
patients that have been a little fearful of it, I'll use acupressure like stickers that look like Band-Aids. I'm like, why don't we just try that? Why don't you just see how you like that and sort of progress on?
No, I love that. That's so great. Um, yeah, the needle phobia is a real thing. As a
Yeah,
clinician, I don't like to be stuck.
me
Not gonna,
neither.
I'm not gonna lie.
I can't. Yeah.
And I think that's a normal response. Like if I had someone who was like, "Yay, I can't wait," to be
Right,
stuck, I
right.
would be maybe a little concerned about that. All right, so that's a good one. How long? So say you're doing your battlefield protocol.
Yeah,
Is that in the ear?
it is.
Is it needles or is it like pressure seeds or?
Yeah, so the battlefield acupuncture has its own stud that you can actually put in, and it looks like a little earring that you can just put in the 5 different points. And it's for acute pain too, Terry. So it's a really good
Oh,
one. Like they could even use it in the emergency department for patients. They actually developed it for pilots in the Air Force, and it was developed by a physician that did acupuncture. And you can work through a series to relieve the pain, and the pain is noticeably improved like pretty quickly as well. You sometimes don't even have to work through all of the points. But yeah, it is really small.
how long does that take? Say if you were going to go through that protocol with a patient.
Maybe a couple of minutes. It's not long at all. You put in a stud and you have them walk around, and then you put in another one and you have them walk around. That's one way of doing it. Another way we do it is like the NADA protocol. I have patients relax in a chair, and pretty much the traditional way that you would receive acupuncture, relax with the room darkened, and I put needles in place and have them sit there for about 35 minutes is the protocol, and rest. And then I come in and take the needles out, and then I put acupressure stickers on some of the points so that they can give a little extra stimulation as they leave the clinic as well.
Nice. And how long do they leave the stickers in when you do that?
They usually stay on it about 5 to 7 days. So they're surprisingly really
Oh,
sticky. Shower in them, sleep in them. So it gives a little extra stimulation that way. Most patients like to have them.
nice. Very
Yeah.
good. I like that. So you kind of told us how we recommend it, and it can be accessible if you could find the people that do it. Do,
Right.
now, health insurance is covering some different things lately.
Yeah.
Do they
Yeah.
cover acupuncture at
Yeah.
all?
Yeah, I've had some. So I believe Medicare covers for back pain. There has to be certain conditions though. Like it can't be related to cancer. I don't think it could be related to a trauma. So
Oh,
that's sort of tricky there. But I've found a lot of patients that they'll actually tell me my acupuncture is covered, and I get so many sessions a year. So I've had a lot of patients where they've had that experience and they don't pay an out-of-pocket fee. So we set it up at Vanderbilt where you would pay out of pocket. I worked with our billing encoders, and we'd be based on the amount of time it takes in the skill level. It was about $31. So that's pretty affordable for a one-time
yes.
acupuncture. Yeah, because if you go for a full body treatment and consultation, you're talking into the hundreds, which is why it was a little bit of a barrier. And so we started utilizing it, and then I'd have some patients say, you know what, my insurance said they would pay for it. And so sometimes we've been able to do the billing and get it worked up. And I have a probably 25% of my patients, they're able to get their insurance to cover it.
Wow, that's really great. Because for a few treatments, if I'm getting the same effect without risking opiates or more
Right.
medication, and patients are functional and feel better,
Yeah.
that's the goal
Right.
with few side effect risks. Okay, we talked a little bit before this because I looked up some facts. And I worked in a chiropractor's office for a while, helping do assessments and joint injections, but I did both dry needling and trigger points. This is not the same thing.
Right. Yes. Thanks for highlighting that, Terry. Yeah, I have to give that explanation. And again, the needle for acupuncture is going to be a lot smaller than what we're going to use for dry needling or trigger point. So acupuncture, there's an acupoint, and it's known to be connected with a meridian and chi for that flow of energy. So all we're doing is stimulating that point very superficially. We're not penetrating and going deep into the muscle like we do with dry needling or trigger
Or
point.
trigger points where I
Yes.
would actually find those knots
Right.
and stick a needle in them. And patients got relief from that as well. Medicare
Yes.
covers 4 of those a year for patients who didn't know you
Yeah.
can get Yeah, trigger point injections, which is very, very beneficial, but not energy manipulation.
Right, exactly. Yeah, now coupled together, this seems like a great remedy for someone who's got some muscle strain, right?
Yes, absolutely. I would always relate dry needling and the trigger point injections similar to when you go get a deep tissue massage and they like stick their elbow in a point or
Yes,
roll over
work
something.
out that knot.
Yeah, same thing. We're just sticking a needle in it. And
Right.
patients will be like, oh my gosh, that's so much better.
Oh
I
yeah,
can't
yeah.
believe how much better I am after you did that. So
Definitely. Yeah. No, I love both. And trigger points are the ones where you're actually injecting something. So usually we're using some sort of
right.
like a solution like lidocaine, and then the dry
Mhm.
needling, there's no solution at all. So yeah, great distinction.
Yeah, I like that. I used to use actual and natural injectable with the lidocaine called it was an anti-inflammatory,
Yeah.
and they don't make it anymore. It's what's topical in Arnicare.
Yes. Yes.
Yeah, yeah, you can't get that anymore. So sorry. It was great. Patients loved it.
Oh yeah.
So you're doing acupuncture now. I love that it was helpful in the neonates,
Mhm.
and really helpful with your oncology patients. What should all clinicians know in primary care? What should they remember? How do they find out more?
Yeah, I would just say know the evidence, and essentially, from what I've read with acupuncture, it can touch on so many conditions, and even if it's just a matter of I'm worked up because I have this medical condition, acupuncture can help. So I always say give it an option. When I'm doing a history with a patient, I consider complementary treatments. What's been tried, what's been helpful, what hasn't been helpful. And this is one of those areas where I'll say, are you interested in acupuncture? Have you tried it? And I'm not saying it's going to cure everything. I'm not saying this is the only treatment, but I think it should always be considered as a complementary treatment.
Nope, I appreciate that. Okay, that's good to know. For looking for clinicians, find someone who is trained, who's licensed, know the licensing in your
Yeah.
state and
Yeah.
what's recommended there, and who can be helping you with that. I love that you're in the office doing that, though.
Right. Yeah. And I mean, it might be something that you could pursue yourself. Find a mentor, or even consider doing full body acupuncture. They do have training programs for physicians, and I do know nurse practitioners that have obtained those. They can be lengthy and expensive, of course, but in the end, they can do full body acupuncture, depending on where their practice site is.
Yeah, and you definitely want to be well trained. There's just so many points to like
Right.
remember and know
Right.
and combinations of things. I would think it would take some time and some practice.
Yeah, I just did the limited techniques and they were, weekend courses. But even then, like there's like a clinical portion, right? Where you have to
Yeah.
demonstrate that you can find the right points, and then you get critiqued, and making sure that you're doing it on the right points on different people as well, because everybody's points don't look the same.
That's true. We are all not built the same.
I did not realize
appreciate that.
everyone's ears were different until I started learning auricular acupuncture, and I was like, oh, these ears look different.
It's never like the textbook. Ugh.
Right, exactly.
just
It's not
had
just
a
a picture.
No, just had a nursing school flashback from when we used to learn to do catheters, and then you do your first real one on a person, and you're like, this does not look like the
It's
textbook at
not
all.
like it looked. No. Exactly.
Oh, I appreciate that. As far as pain and opioids are concerned, since that's one area, and then I'm going to touch on palliative care. Besides acupuncture, what are some other adjunctive therapies that really make a difference that clinicians should be thinking about?
When we're treating pain,
Yes.
yeah. I think it's always really important to assess psychologically how's the person doing. I think that's a big piece of the person that is often overlooked, because that can really worsen the pain. How are they
Mhm.
coping? What is their function like? We know we've talked about sleep, and if we're not sleeping, you're an agitated person, and now our mood is all messed up, and we're not interacting with people very well, and then now our pain is probably worse. So I think that's a huge portion to look at. And then there are so many like cognitive behavioral therapy type options. Like we can do formal therapies and counselings to support the person, but there's also things they can do on their own, like guided meditation and that sort of thing that they can just look up on YouTube of how do I just learn to take a deep breath and calm my nervous system down.
I like that. I think that's a really important place to start with all of our patients. You're now in palliative care and oncology. I know pain is a completely different thing, but does that translate to that group? Like,
Yes.
do you just
Oh,
ask your patients, how are you doing? Let's
yeah.
just start there.
And boy, does that open a conversation, because honestly, so many times we're focused on our thing and our what are they here for? What's their primary complaint? But yeah, it's in my line of questions. I get to the type of pain and I'm treating that. And then I'll just ask, how are you? How are you doing with this? How are you coping with this? And even whoever they're in there with, their spouse or their caregiver or their daughter, their son, I'll look at them and say, how are you? And then like all this stuff comes out. And it's amazing how you identify other interventions that you can do to help. Like, oh, you're having some financial constraints. Let's hook you up with a financial counselor. Oh, you don't have a bedside commode that you can use. I can help with that. You just should have told me. You know, they just don't know. Patients don't know to tell you sometimes.
Well, I like that open-ended question. I think
Yeah.
that's good. Do you ever, on the patient side of this, and then I'm going to add peers and clinicians questions, do you ever have patients who were like, I didn't think this would work, and then they let you do it and they're like, oh my gosh. They're
Yes.
like telling everyone else, like converts.
Yes, yes. Oh, yeah. I have patients that have come to me for years, and absolutely converts. And that's where I tell them, I joke about it. I'll say typically my acupuncture is the gateway to acupuncture because it's affordable. And I'm like, I can do it right here. We can do it right now. You know, like we don't have to set up another appointment. We can just do it right here. And that's usually how I get the buy-in for those type of patients that are like, I've never done it. Oh, I don't know. And then they will come concede like it actually has been really helpful. And they'll usually come about monthly, every 2 months. But that's usually the conversation that we started is it doesn't hurt to try. It's only $31 in our institution. It's pretty affordable. Why not give it a try? Because if it's helpful, you know, essentially my patients will say usually, well, I'll try anything, you know, and if it works, then I'm open to it, especially when they're taking medications that cause a lot of side effects.
Yeah, I think that's an important point. Did you have a specific patient at all? Because I remember my dissertation and what led me down that path. Did you have a patient or a cluster of patients that really stood out to you as, oh my gosh, we should be researching this or offering this?
Yes. So I had when I was working in the interventional clinic, it was during a surge of like a height of opioid epidemic in the state of Tennessee. So I was having a very high population of patients where day in, day out, I was having to have a conversation of first line treatments aren't opioids. I'm sorry that you've been put on opioids. I'm happy to help you come off of the opioids. And here's how we do it. And the research kept saying acupuncture, acupuncture. So that's what triggered me to say, well, I really want to offer these patients acupuncture. And then, of course, when I got my training, I did have a patient that I had gotten him off, and the medical record, like I was noticing a difference. Like he started off seeing me walking on a cane, kind of limped over. He looked 15 years older than what he actually was in his age. And then I started seeing in the medical record, even his primary care doctor and other providers that were caring for him were noting he looks much younger. He's walking now without a cane. His wife was talking about how he was able to do more and he would actually go out to dinner, and before he didn't really want to do anything. So I saw this like lovely progression, and I thought to myself, this definitely should be studied.
I love that. Yes, making patients better for better outcomes in lives. Did you have any of the other clinicians like side eye you? Like this is not the clinic. We are not going to be meditating, sticking needles in people. And
it took quite, because it was a little further back. I think I started this in 2012, 2014, I think is when I pursued this. And yes, I actually had some people refer to it as voodoo, that we don't do voodoo. We don't want you to do voodoo. But then, you just kept citing the evidence, and you really can't debate the evidence, especially when it's really well done and high quality evidence.
I like that. I grew up in the Midwest in God-fearing country, and some of that stuff, they're like, that's Satan. I'm like,
yeah.
It's actually not. It's
Right,
just
right.
a pressure point for energy. but
right.
okay.
I mean, what's it hurting, right? And then it was sort of more well accepted, like, okay, let's try
Yes.
it.
Yes. Yeah. Being mindful of people's cultural, however we can get them some improvement, especially in the
Absolutely.
realm of pain and
Yes.
chronic symptoms, which can be emotionally and physically exhausting.
Absolutely. Absolutely. And one nice benefit with acupuncture is like the techniques that I use, it's stimulating your neurotransmitters. So it's actually producing endogenous opioids. So it's natural. You're getting that pain benefit naturally from the body, but you're also getting that uplift of, like I was saying, there's quite often a relationship when you've got someone with a chronic condition. Their mood's probably not going to be the best. I mean, mine wouldn't be. Like what you're reporting right there. That does not sound like a fun scenario. So what does it hurt to do some uplifting neurotransmitters too?
Let's see. Oof, you're just making this sound more appealing. I'm going to hang up from the podcast and like look up who can do. I need some
Right.
endorphins.
We're going to have an auricular acupuncture workshop at the upcoming PMAP conference, Terri. So I'll have
in
some
Orlando
needles with me. We might have to try some needles.
Oh, I might have to come over there. So we're just right before you in Orlando, and see the listenership is going to be like, what? Because this is going to show afterwards. But you could have been there, people, and
Right.
we
Come next
ran
year.
some meals, right?
Yes.
Yeah, you guys are going to have a national meeting next year, and we'll continue to work on that. But I love that there's an Advanced Practice Provider Association for pain.
Yes.
I think primary care should be heavily involved in that, as we're getting access fewer and fewer and longer wait times into specialty clinic. And I think
Absolutely.
these discussions are critical. What else is there? We have got
Right.
to offer patients solutions when we just say, you can't have any more opioids. Oh,
Right.
and your NSAID is raising your blood pressure, killing your kidneys. Like,
Yeah.
I don't want to just tell people we're at the end. We're just going to send you to pain management. And they're going to
Right.
stick needles in your back now, like, and do
Right.
procedures.
Yes, no, there's definitely a lot of options. And I have those conversations too with patients that have aberrancies, and we're having to have those conversations of, I can't treat your pain with opioids, or they don't want to treat their pain with opioids for sobriety. Let's look at other options. There are a lot of other options out there that we can look at.
Yeah, and I love that this is an accessible one. And I love that you started with just auricular. Like,
Yeah,
we can make this accessible for patients, and 25% of your patients are paid for. Like, that was a
right.
good answer. I didn't know it was that high.
Yeah. Oh, yeah.
All right, cool. Well, if people want to find you, where can they find you besides coming to the thing, to your conference that it's going to be after? Sorry,
Yes,
people.
yes. Yeah, you can look me up on the Vanderbilt University Medical Center website. They'll have my practitioner profile on there and my information on there as well.
Oh, Dr. Jackson, thank you so much for being here and sharing your wisdom and talking about acupuncture. This has been great.
Of course. Thanks for having me. It's always a pleasure speaking with you, Terri.
Yeah, a pleasure speaking with you. I'm sure we'll talk about something else in the future. For our listeners, be sure to check out everything NPACE at www.npace.org for all of our information. We have our 2026 in-person and virtual conferences. We're going to do a 2-day radiology conference where we're just going to talk x-rays, MRIs, CTs, do some basic learning. So shout out on that one. We did Lab Fest last year. We're going to Napa in 2026. If anyone wants to go to Napa,
Who doesn't want to go to Napa?
Right? Heather writes it down. I know. Napa. Yeah, but we're an ANCC accredited provider, and now we're providing CME for our PA colleagues across the aisle. So all things NPACE for all APPs. If you need us, you can find us at www.npace.org. Stay tuned for the next Friends of NPACE podcast, and we'll see everybody later.